All right, so we're going to talk about the differences between trigger point dry needling and acupuncture. So acupuncture is the Eastern medicine. It relates to meridians, chis, and ashi points, so it follows maps, whereas dry needling, what we do, this is where the skilled part comes in for us, we palpate trigger points. So for him, like we done on the other video, we palpated a nice trigger point on him, you trap that trigger point down, and then that's what you needle. So we're releasing what we find. A lot of things that we needle, we can needle upper trap, we can do neck, multifidi there, all the way down the spine. We can get shoulder involvement as well, so you've got infraspinatus, teres major, minor, supraspinatus. We can do any part of the deltoid, tricep, bicep. A lot of people with tennis elbow or golfer's elbow get a lot of pain at the lateral and medial aspect, and we can dry needle that. So I would get like a brachioradialis, just wrist common extensors, and then you can drop a needle down and get supinator as well. If people come in with hand problems, say they work fine motor quite a bit, there's a lot of needling that you can do in between. So adductor muscles, you can get lumbricals in between here. And then not a lot of people get pinky pain, but this is another muscle that we could dry needle as well. I have been trained to do rectus. I really don't do rectus a whole lot, but tight hip flexors, so iliopsoas would be one that we could do, QL. Glute muscles, a lot of people have, especially runners, like proximal hamstring pain in the back. So yeah, if you want to stand up, so we would palpate the ischium there, and then you go just lateral to it, and we can get a proximal hamstring insertion dry needling. We can do that alongside with the electrical stimulation unit that we have, and you hook them up for about 5 to 10 minutes, and it gets a pretty good result. You can also get calves. We do plantar fasciitis with that. If you've got any quad pain or scar tissue buildup, we can needle that as well. If you're not seeing any good results with just the direct needle technique to the area where there is pain, you can follow the nerve path all the way back up to the spine, and I do see pretty good results with that as well. Glute muscles are pretty good to do. A lot of people with low back pain, you can get lumbricals. QL is another one that we can hit this way. So there's quite a bit of places that you can dry needle. Tendonitis is a pretty good one to do, just head to toe. You can turn back around. Tension headaches, that's another thing. We can start up here and get suboccipital muscles. You can get semispinalis capitis, so it's actually back on your skull there. We can get masseter and temporalis as well, and a lot of times you get jaw pain and TMJ with tension headaches. So really, whatever you're having pain with, we can treat with the needle, just to jumpstart the program and then get you going with some good exercises to follow through.